Right. So there are definitely things we can do for depression. And of course, as it highlighted, that activity, restructuring your thoughts, and um, gaining a different perspective on life, these things can help us. So let's just explore a bit what we can do for depression and getting out of these things. So I just like to highlight that there's been many studies for the treatments and different outcomes, and these studies show the efficacy of different trials, different interventions that have been applied, pharmacological, psychotherapeutic. So if those of you who are interested, you can check out this source. The study highlights a lot of them. So coming to the practical part of this, so different treatments for depression may include medication. There are different types of antidepressants available that can be prescribed by a consultant or a psychiatrist. These may include first generation tricyclics or MAOIs, and then there's second generation antidepressants as well. So depending on your biochemistry, your physician might prescribe you with a suitable medication. And of course, having medication in conjunction with psychotherapy, which has been proven again and again to be um, a very good treatment for depression. And when we talk about psychotherapy, specifically CBT, which is cognitive behavior therapy, which is a talk therapy which helps you identify different various patterns of thought and then engage in different behaviors. This can be very useful as well. For severe cases, for severe depression, where there's a lot, definitely residential treatment or hospitalization might be warranted. And of course, it's rare, but it does happen. So that's just to keep in mind that it can be warranted as well. ECT is something that's not used as frequently, electroconvulsive therapy, where the brain is stimulated by minuscule shocks to the brain, but it is still used in some parts of the world. I think there's some institutions that use it here, but this is like a very last resort. And definitely it's used when antidepressants are not working for an individual. An alternative that's come across, and it's like a newer version of this, is transcranial magnetic stimulation, TMS, which stimulates the brain through magnetic pulses. So this is a particularly non-invasive method that's been introduced. And unfortunately, this treatment has not been uh, introduced much in Pakistan, but of course it's available in Europe, and it's part of their general healthcare system as well, Europe and the United States. So what is cognitive behavior therapy simply? Basically, cognitive behavior therapy is basically the cognitive models posits that cognition, anything that goes inside our head, is composed of three factors: thoughts, behaviors, and feelings. And all of these factors are interlinked. So if we influence one of these factors, we can definitely influence another one. And definitely, if we can change the way we think, we can change the way we feel. So it was an ancient Greek philosopher, Epictetus, who said, "We're not bothered by the people or the things around us." Again, it's not people or things that bother us or circumstances, it's the views or the perspectives we keep of them. Hence, changing the way we think can definitely change the way we feel. And again, changing the way we behave or acting activity can actually help us out. So one of the major tenets of CBT, cognitive behavior therapy, is behavioral activation. Because in depression, a person is likely to engage in less activity, and it's because of lack of motivation, loss of interest, and loss of pleasure. So, one of the major treatments involves that getting an individual back into activity and getting them going. So, a therapist may help you plan out your daily activities, help you through different tasks, like graded tasks, and then in the long term, this will help you out. And of course, your therapist will help you out along the process by tailoring the process to your specific needs. Then, second, we talked about cognitive restructuring, which negative thinking is a hallmark of depression. And again, the way we think entails the way we feel. So, CBT teaches us to identify the thoughts, then evaluate them, and then finally it allows us to cope with these thoughts by changing our perspectives on things. Again, there we are nuanced. We're not incorporating positive thinking as per se, but it's more of a bringing our thinking alignment to a realistic thinking pattern. So that's what CBT teaches and cognitive restructuring focuses on. So, to understand the cognitive restructuring bit, I'll just like to give you a quick view of the cognitive triad, which was proposed by Aaron T. Beck. He said, when an individual is suffering through depression, he views the world through a very negative kind of perspective. So, through that lens, they view themselves in a negative view, they view the world in a negative view, and then they have negative views about the future as well. So it's kind of like a cognitive triad. And to break this, we need to have alternative and nuanced views of the world, and which we'll cover ahead, right? So, word of caution, it is to understand that loss of interest, these symptoms, motivation, isolation, they may warrant suicidal thoughts in people as well. So, if situations do seem dire, if you or a loved one or a friend seems to be in certain situations where situations seem dire, please feel do contact a mental health professional. You guys have lumps, gaps, do reach out to us. And there are also other mental health helplines in case we are not available. These operate off hours as well. So you can contact CAPS. They can send you these helplines as well. So going on, so what can we do to do for ourselves? Things that do not require the intervention of a therapist as per se. So the first thing we can do is we can start to get into a routine, because again, we talked about how behavior activation is a great part of the therapy or the treatment protocol. So having a routine, then setting goals, this can be very helpful for us. It might seem like a very little minuscule change, but it does help. It helps out a lot. Um, okay. So setting goals, and when we talk about setting goals, it's always a good idea to have very specific, measurable, attainable, realistic, and time-bound goals, which I call SMART goals. There's a lot of material available as well. So setting SMART goals, setting a routine, getting in exercise. Of course, exercise has a lot to do with it. We'll just be covering it ahead. Eating healthy, eating right foods. There are foods that promote good bacteria. They can promote the production of serotonin in your body, and they make you feel good. So definitely diet has a great impact. And getting sleep, I have to emphasize the importance of sleep, because sleep is one thing that, especially during our college times, we tend to neglect a lot. So it's something that we need to be mindful of. And I do understand the deadlines to meet and there are different projects going on, but trying to be as consistent as you can, or trying to be having a at least trying to have a pattern might be very helpful for you. There are specific sleep hygiene protocols as well, which we'll discuss in a while. So sleep is very important because it directly impacts the mood, and there's been various studies on this as well. So taking on responsibilities for other people and upon yourself can give you a different holistic perspective as well. Challenging negative thoughts, which is part of cognitive restructuring, can definitely help. Supplements, certain supplements are available in the market. You can go for them, but definitely, please check in with a medical consultant or physician before trying out anything new. Don't try anything out on your own. Don't self-medicate. It's not a good idea because it might have harmful effects. Trying out new things can definitely help as well. And things that you used to enjoy or you used to have fun in re-engaging in those activities, even though they might seem very counterproductive at the time, they might be very helpful to get you out of that slump.